Welcome back to Great Day St. Louis. It is time to wash away the pounds. You heard me, wash away the pounds. Here to show us the advanced technology of the Body Jet Liposuction is Dr. Erick Falconer from Youthful Body in Clayton. Doctor, so nice to meet you.
Thank you, same here.
This is, frankly, I'm a little concerned. I got a little bit of butterfly action here because we are so desensitized to the video of liposuction we see on TV,
right,
which is a guy with the needle really working it. You know what I mean?
Absolutely.
This is a whole different ball game.
This is a totally different ball game.
So what's the difference between the standard lipo that we've all become accustomed to and this new technology?
Well, the major difference is the Body Jet utilizes the gentle power of water.
Okay.
And so by doing that, you don't have the mechanical force that's going to cause a lot of bruising and potential bleeding. We just use a gentle stream of water, and I can just show you an example of how fine the mist is. That's it.
That's it?
That's it.
And that's going on under your skin. Do it one more time for us. Now, see, this is a little bigger than my tetanus shot needle from a few weeks ago.
It is, but the reason is because it contains both the delivery of the solution, it also has the ability to suction. So you dislodge the fat, and you're continuously removing the fat at the same time.
So that's the purpose of the water? The water goes in to sort of knock the fat loose?
Exactly.
And then you go into suction mode?
Exactly.
Now, let's walk me through this process. I come into your office, we've had a consultation.
Absolutely.
I mean, clearly I don't need any work done, but let's just say we get to that point.
If you were to come in, yes.
Are we still going under a general anesthetic here?
No, absolutely not. I perform all my Body Jet procedures with local anesthetic.
Really?
Which is the mist that you saw come out of the cannula. That contains lidocaine. And so it numbs the area while we suction. And so it continuously numbs the area, so you don't feel any discomfort whatsoever.
So you're awake and conscious for the procedure?
You can be. Most patients usually elect for what we call a sedation. So we give them medications just to lightly sedate them.
Okay.
And they don't usually remember much of the procedure at all.
So let's talk about the amount of time it takes to do the procedure, the amount of recovery time, and how that all compares to the standard liposuction.
Absolutely, absolutely. Well, it's a very short procedure. It can be as short as 1 hour. Sometimes it can extend to 3 hours. Depends on how many areas we're targeting.
Gotcha. And speaking of which, I have heard that the stuff that you take out from one area, with this new technology, you can just put right back in somewhere else where you need some filler? How does that work?
Well, you know, fat is a living cell. So in medical terms, we call it the adipocyte. So a fat cell, they're living. And because the water is so gentle, we don't destroy the fat cell. We can just remove it, and it's still viable. And we just reintroduce the fat in the area where it's wanted.
Wow, so if there's wrinkles in the face or a little other area where you want some filler?
That's the true value of this procedure and this device is that we can remove the fat, and then we can use the patient's own fat to target areas of the face or even lip augmentation, buttock augmentation, etc.
As folks are listening to you, they're seeing some before and after that was done with this piece of technology. Tell us what we're obviously before on the left, after on the right. That's a significant difference.
Yeah, and that's the most common area that our patients want to target is the abdominal area by far.
The belly and maybe the rear end.
Yeah, and that's a common location to store fat.
Now, is this a situation where you went in with some filler?
This is a situation where you actually transfer, you see on the left the before, where you have the what we call nasolabial folds, the lines from the nose down past the mouth. That tends to get deeper as we age and lose volume or fat in the face. So it's kind of ironic. You lose fat where you need it, and you gain fat
where you don't want it.
Exactly.
What's the downtime? How long are we going to be out of commission?
You know, it varies, but anywhere from 24 to 48 hours. So typically, we perform the procedure on Friday. You're right back at work on Monday. And
the cost is going to depend so much on what you're having done.
It depends on the area. It depends on how much fat we need to remove, and it depends on where you want the fat to be, you know, introduced.
Removed and introduced, all in one stop.
All
Amazing.
in one, yes.
Dr. Falconer, thank you so much. If you're interested in finding out more about the Body Jet Lipo, and this is the only guy in Missouri that has it, by the way, you can contact Youthful Body at the number on your screen right there. It's area code 314-692-2639. Or you could check out their website at theyouthfulbody.com. Carol, I mean, you know.
You said my name with a question mark.
If it's this versus the old school, I'm going with this.
This looks much better. But, and by the way, if fat is a living thing, I need to be charging it some rent. I need to be making some money.